Hello and welcome back to the Stay Sure Wellbeing YouTube channel. I'm Dr Dawn Harper and today we're going to be talking about travelling with heart disease. Heart disease is a very common problem, and in my experience as a GP, often patients feel a lack of confidence soon after they've been diagnosed and don't necessarily want to travel. But for most people with heart disease, there's no reason why you shouldn't go away and enjoy a holiday. Often people feel more comfortable travelling short distances to start with, and if you've got severe heart disease, it is worth checking with your doctor, your GP or your specialist about your chosen destination. Extremes of temperature and high altitude can put a strain on the heart, and it may be better to choose somewhere with a more moderate climate. If you have a pacemaker or an internal defibrillator, you will need to travel with your device ID card, and do check with your airline beforehand as to whether or not you'll be able to go through security. You can request a hand person-to-person search rather than going through the security checks in the normal way if this is necessary. But you may need to take a letter with you from your GP confirming that you have this in place. And whilst I'm talking about your GP, do plan ahead in terms of making sure you've got plenty of medications, that they're all in date. I always advise travelling with some extras in case of delays, but in current times, I would say take double what you think you need, just in case you find yourself in a local lockdown or needing to quarantine somewhere else. It's also important that you have a list of your medicines, both the trade and generic name, because medicines have different names in different countries. And I think it's well worth checking out a few of the local language issues, so things like chest pain, shortness of breath, hospital. And for your peace of mind, it's worth knowing where the local services are, so the local GP, the emergency numbers, the local hospital. And for most people with heart disease, they prefer not to travel alone, certainly when they're first diagnosed, and I completely get that. So it's important that anybody that you're travelling with knows about your condition and your medications. As always with any long-term condition, please do travel with your medication in your hand luggage and preferably in the original packaging. Depending on your heart condition, you may want to choose your holiday accordingly. High adrenaline, high activity holidays may not be on the agenda for you, and it may be better to choose something more relaxing. Relaxation and a holiday away are really good to reduce your blood pressure, reduce your stress levels, so they're good for your heart if you choose the right vacation. And always, please do tell your insurance company about all your medications and conditions to make sure that you are adequately insured in whichever country you choose to visit. I do hope you have a lovely holiday. Take care, and until next time, please remember I will be here every month with different videos, so please, if you have a subject you'd like me to talk about, please do message me here or email us anonymously on the website. We want this to be a useful resource for you, so whatever your condition, if you want some top tips on how to travel safely, please let me know. But until then, take care.